but also internationally and also with the White House. We actually fund over 7 organizations to help preventative care and to do initiatives to help with HIV and hepatitis in the District of Columbia. One of the things in the district is we have an outrageous HIV and AIDS rate here in the city. We're actually over 2.3% over developing nations. So, you know, countries like Ethiopia have a similar rate as the District of Columbia in HIV. So we need to do more things to prevent. We need to do more strategic planning with local, international, and also national groups here to really see how we can strategically change this. So thank you for being here. Please reach out to our office here on U and 14th Street. We need to do more partnerships. We really need to develop a plan to prevent this, to do more initiatives. Groups like Clínica del Pueblo, Mary Center, Andromeda Transcultural really help to fight this in the District of Columbia. So thank you.
Communities across the nation help get trained and boost the visibility of the Latino HIV/AIDS disease, and not only disease, but the prevention efforts that are important that need to go across the country. The National Hispanic Medical Association represents 45,000 Latino doctors in this country. We're all over the country, in Puerto Rico and west coast of Hawaii. We work with the Commission to End Healthcare Disparities. We represent Hispanic doctors to the American Medical Association. I'm also chair of the Health Committee for our Hispanic Leadership Agenda here in Washington, D.C. We just came back from the Democratic Convention, and we're on media with the Republican Convention, and AIDS is one of our top recommendations in terms of increasing prevention and treatment for HIV/AIDS for our communities. That's how important our leaders believe this disease is. So, and I just want to congratulate the importance of having a National Latino AIDS Awareness Day in October and the National Hepatitis Latino Awareness Day in May. Thank you very much.
This type of events, but I want to really recognize in your program all the partnerships, all the partners, that together really rally support for our efforts. And also I want to recognize every single representative that joined us to co-chair this important briefing of the impact of HIV and viral hepatitis in the Hispanic communities. And again, especially recognition for the staff working very hard to get us this room. Representative Ileana Ross was very instrumental, as well Representative Lucille Roba, Representative Perlucci, Representative Honda, that are here in a minute will talk, and Representative Lee, among others, that really recognize the importance of addressing the impact of both hepatitis and HIV. Several staff are here in the room, from Senator Duval, Senator Lieberman office, Representative Davis, Representative Logren, Castor, Senator Franken, and Chief of Staff of Representative Perlucci from Puerto Rico. All of us coming together to address this issue. We are few weeks away from National Latinos Awareness Day. I will encourage all of us to work together to address the impact of HIV and AIDS, to address the impact of viral hepatitis, and especially, you will hear from several speakers today, the timing to address this issue, especially in the rapidly changing health environment in the United States. We encourage all of us as partners to look especially Medicaid by each state and territory. We also want to highlight that we are deeply equal concerned about the impact in the 50 states, but also Puerto Rico, U.S. Virgin Islands, and the beautiful capital of the nation, Washington, D.C. And again, we are honored also for the ongoing commitment of Roxana's office, and the unbelievable energy and vision and hard work of Dr. Elena Rios with the Hispanic Medical Association, who we celebrate working very close to address several issues nationwide. I'm very proud to welcome all of you to this briefing, and I'd like to welcome first Representative Lucille Rollback to share some remarks with us. A champion for our community and a very important representative from the state of California. Thank you.
As chair of the Congressional Hispanic Caucus Task Force on Health, I want to welcome all of you to today's congressional briefing commemorating the 10th annual observance of National Latina AIDS Awareness Day. And I would like to also, again, acknowledge my co-sponsors, Barbara Lee and Ileana Ross-Linton, and also to acknowledge Mike Honda, my colleague who is here, who has not only been a leader in HIV and AIDS, but has really been out there with regards to policy dealing with hepatitis. So Mike, thank you for being here. I also want to extend my sincere thanks to the Latino Commission on AIDS for their valuable advocacy and also for bringing us together and bringing this impressive group together to update us on the HIV, AIDS, and hepatitis crises, which is facing our Hispanic community. You know, since 2003, on the last day of Hispanic Heritage Month, the Latino Commission on AIDS has challenged Latinos in this country to get tested for HIV/AIDS in order to protect themselves and the ones that they love. This is particularly critical now because, as we know, HIV/AIDS is disproportionately impacting our Latino community. And Latinos have a higher rate of new HIV infections and higher rates of AIDS diagnoses than our white counterparts. Latinos are progress, and this was something that I myself hadn't realized until recently, but the Latino progress from HIV to AIDS is faster than any other racial or ethnic group. And in fact, HIV was the 6th leading cause of death for Latino men and Latinas ages 25 to 44 in 2007. This year's briefing is also going to focus on the important relationship between HIV/AIDS and viral hepatitis in the Latino community. Research is now telling us that persons with HIV infections are disproportionately affected by viral hepatitis. About 1/3 of HIV-infected persons are co-infected with hepatitis B or hepatitis C. Unfortunately, viral hepatitis also is having a disproportionate impact on our communities. Hispanic adults 40 years and over are 30% more likely to develop hepatitis B, and Hispanics are twice as likely to die from viral hepatitis as compared to our white counterparts. These are very dire statistics, and our distinguished panelists are here today to discuss the health challenges of responding to the HIV, AIDS, and hepatitis epidemics in our Hispanic communities. So I thank them for sharing their expertise and their experience. I thank you all for being here to gain their insights and to gain the information that is going to be so important, not only in determining policy here in Washington, D.C., but also in helping to carry that message into our communities back home. So again, thank you for being here, and I look forward to continuing to work with all of you to maybe someday we all get together to celebrate that we have made HIV, AIDS, and all the negative impacts that it has had, not only in the Latino community, but throughout the country, something of the past.
Good. Raise your hand. Let me shoot you proud. How many from nonprofit clinics and stuff like that? How many are physicians or in CDC or HHS? I didn't think you raise your hand. See, I recognize you. So this is really important, and a lot of things have been said about HIV/AIDS, and I think that the reason I'm here is to really a couple of messages. One is that we've been working with HHS on HIV/AIDS and also hepatitis B. And I can tell you that the organization is highly organized and committed to these issues. What we need to do beyond that is to make sure that our communication is complete and that we close the loop on information and then also dissemination of information. I'll be working with communities in California and my own community too on hepatitis B and trying to raise awareness, because one of the things I've learned over the last 5-6 years is that both HIV and AIDS can be what we call a silent killer, because sometimes you just don't know you have it. Hepatitis B, for Latinos and for Asian Americans, we're probably one of the prime folks that really are affected by it. Over the next 10 years, it's predicted that there'll be about 150,000 folks that will die from liver cancer or chronic liver disease. And that's us. And so it's really important in our own communities that we not only become aware ourselves of the issues, but also extend that information out to our communities, through our clinics and everything else. Like, it's about educating. When I was a youngster, the disease that scared a lot of us when I was a young person, a long time ago, the last century, TB was a thing and polio was a thing that scared us, you know, and we've conquered both. They're not all completely eradicated, but it's significantly, I mean, it's almost insignificant in terms of the kinds of things that we have to do, the worry that we have, but you always have to be vigilant. In this case, we have to be vigilant and also educating, so that we have people aware that if you're male and you're Latino or Asian, the likelihood, and you're involved in a lot of people who travel, things like that, you may be, vulnerable to hepatitis B, and you can go for years and not know it, and all of a sudden contract liver disease or chronic liver disease, and then ultimately die. And so it's pretty serious. So I got involved in a health fair in San Francisco with the mayor then, who's now the lieutenant governor, a couple of friends in San Francisco. We publicly took, we went through the examination, and I found out that I was negative as a mother. And then I said, so what's the next step? 3 procedures. And then the likelihood of me ever getting hepatitis B is very low, even though I may be exposed to travel to Asia a lot. And so it's a relief. But my friend, she found out she's a carrier, but never knew it. And there's remedies for that. But the bottom line is that we started to use ourselves as a model to let people know that it's better to know and understand and to teach. So in the old days, you know, before you guys were born, we used to say each one, reach one, each one, teach one. That was real popular in Oakland and San Francisco Bay Area. So I think that that's one of the things that we need to leave here today, is to become aware and then pass that awareness on, so that we move towards elimination of HIV and hepatitis B. We got others, A, B, C, D, all that sort of stuff. But the main thing is that people like myself, and Lucy and I are on corporations, that we make sure that we support research, we support clinics, and we support this thing we call the Affordable Health Care Act, that we completely, we do the full-blown thing. And one of the things that the Tri-Caucus has done, CBC, CHC, and KPAC, and Progressive Caucus, is that we work together to make sure that the information that we got from folks like yourselves gets folded into the policy, so that we eliminate the gaps that exist in our communities, that we address and we become culturally and linguistically sensitive and appropriate, and that we go into our communities and take from there, folks like ourselves to be educated, become service providers in whatever categories that we need to do it. But the goal is to reduce human suffering and eliminate this disease. So to all of you, I thank you for your work and for your interest. And to the Commission, muchas gracias por todo su todo que hace.
Thank you for a few moments about viral hepatitis. I really appreciate the work of the Latino Commission on AIDS. It was nice to meet Roxana Olivias from the Office of Latino Affairs, because we really need to begin marshaling more resources to combat this silent epidemic, as Congressman Honda just alluded to. We have a real health crisis in this country related to viral hepatitis in the considerations of CDC. We have 3.5 to 5.3 million persons living with hepatitis. As the Institute of Medicine has informed us, many, if not most, upwards of 3 out of every 4 of those persons are unaware of their infection status. At a time when disease and death from hepatitis are on the rise, and that's manifesting even more so for Hispanic Americans. Indeed, as we reported a few months ago, the number of deaths from viral hepatitis has surpassed the number of deaths from HIV/AIDS. And I think we really have to celebrate the tremendous collective achievement of those declines in HIV that are represented by those mortality trends. And there's still much work to do to decrease that mortality rate even further for HIV/AIDS. But it's really a marker for me as someone who worked for about 14 years in HIV/AIDS prevention before moving over to viral hepatitis, of what can happen when public health, clinical medicine, government officials, and community-based organizations and advocates come together to try to solve a public health problem. And we've made tremendous advances that we've made for HIV/AIDS prevention is an excellent, probably the best representation of that in the history of public health in the country, while still recognizing we have some miles to go to reach our ultimate goal of completely eliminating HIV from generations of Americans. But we're sort of much further behind in that type of effort for hepatitis. And for Hispanic Americans, they're sort of faced with a double whammy because chronic hepatitis, which is the major cause of disease from hepatitis, is caused by 2 viruses, in contrast to just one for HIV, hepatitis B virus and hepatitis C virus. And for Hispanics, many persons immigrating from countries are infected with hepatitis B virus at the time of birth when they're not vaccinated for hepatitis B. And indeed, when we look at foreign-born Americans who have high rates of hepatitis B, 2 of the 5 countries from which the largest numbers of immigrants with hepatitis B are coming from are in Latin America, Mexico, and the Dominican Republic. And for me, it's a reminder that these sort of Census Bureau designations of race, ethnicity, are only helpful to a limited degree, because underneath that large Hispanic label, there are multiple ethnicities and social, cultural factors based on country of birth and other factors. And even though a Spanish language is one unifying aspect, you have to recognize those differences in communities when you're really trying to make that public health work happen at the local level. And there are other examples of other countries such as Brazil and Colombia and Venezuela that also have excess rates of hepatitis B among immigrants. So that's one effort, is to get hepatitis B vaccine implemented in this country, but also in those countries around the world, so that persons coming here are hepatitis B free. And then for those who are already infected, CDC has recommended that persons who are foreign-born from countries with high rates of hepatitis B need to be screened. So that's something we can work on together here, is spreading the word about hepatitis B and getting more persons tested and into care. Because we do have effective therapies for hepatitis B that can slow or even reverse the liver disease. And as a public health person, when you have prevention tools like a safe and effective vaccine and curative therapies, I want to do something about that. And I know that's why you're in this room today as well, that you would like to do something more. So I really appreciate the AIDS organizations expanding their focus to include viral hepatitis, because we really do have an opportunity, and we can work together. You have important inroads and relationships in communities that can be used to raise the awareness about hepatitis. You have clinicians who are beginning to move and to become hepatitis treaters, not just HIV/AIDS treaters. So that's very good news. So there's a lot of movement in the field, and I really want us to work together, because just like we had success when we worked together in HIV/AIDS, I want us to work together for viral hepatitis. We have an education campaign that we call No More Hepatitis, KNOW, which is sort of a take on we want more awareness so that we can achieve that NO in the KNOW. So hopefully one day, as we try to spread the word today about knowing more about hepatitis, we can come together in the future and celebrate the NO More Hepatitis. Thank you very much.
This is a packed house, and to see so many key partners, and the fact that we had such great representation from the congressional offices as well. All of you being here shows that there is hope for the future, because we're all here together to address the needs around HIV and hepatitis in the Latino communities. So consider the following for a few seconds. We're 30 years into the epidemic. For the first time in 20 years, the International AIDS Conference came back to the United States. And we just had our first national AIDS strategy. So where does that leave Hispanics and Latinos in the U.S.? And I use Hispanics and Latinos interchangeably. I know some of you may have some strong opinions on that, but go with me. I'm just going to use them both. At this point, we have the national HIV/AIDS strategy, and as Dr. Ward mentioned, we are seeing lower mortality rates, but Latinos are still suffering disproportionately from this epidemic. And at this point, I'd like for us to think about how we renew, refocus, and re-engage our key partners and our hermanos y hermanas in our Latino communities across the United States in thinking of how we take the national AIDS strategy and address the epidemic. We know that many Latinos are oftentimes not at the table when it comes to discussing some of these matters, so all of us being here brings us hope that more Latinos will be at the table. We also know that in the data sets that are often presented on Latinos, and I will present some of the data, but some of the previous speakers already spoke to that, but we know that sometimes some of these data sets do not give us the full picture on the epidemic in the Latino community, because many are not represented in those data sets. Oftentimes Puerto Rico is left out of the data, and oftentimes Latinos don't even self-identify as Latinos, so then they don't get counted. So that's something we need to think about going forward, especially as the census changes the way Latinos will start identifying going forward, and how will that data then match up with the EPI data sets. Something that we have to think about also is how do Latinos in the District of Columbia, Puerto Rico, and the U.S. Virgin Islands get addressed in this national AIDS strategy, and how do they get counted also in the EPI and surveillance data. I mentioned that this was the first time in 20 years that we held the International AIDS Conference in the United States, and we made concerted efforts to bring many Latinos to the International AIDS Conference, and we have some key partners here who were part of that effort to bring Latinos to the conference. And even with that concerted effort, there was still the Latino voice missing from the International AIDS Conference. And there was still the data missing. So if you look at the abstracts and the program, not many of the abstracts focus on Latinos in the United States. And that's something that going forward we have to think about in promoting more research to be done and promoting more community-based organizations to talk about at a national level what it is that they're doing in the Latino communities to address HIV/AIDS. So let me give you a few numbers. What we know is that Latinos are 16.4% and rising, because just last year was 16%, now we're 16.4% of the U.S. population, and that means that we're 1 in 6 of every individual in the United States. That growth has also exploded in the deep south of the United States, where you have 10 of the top 12 states being in the deep south that have seen the biggest growth. Let me give you an example. South Carolina had over 147% growth in the Latino population in the past decade. What do we know about the Deep South as well, besides being a place where Latinos are migrating to? It's also a place where the HIV incidence rates are going up as well. So we are at this intersection where Latinos are growing exponentially in certain areas, and then we also see that the HIV AIDS rates are going up there as well. So it's something that we have to definitely address. Something that Hillary Clinton said at the International AIDS Conference when she was doing her opening plenary is that we know which road we need to take going forward to reach an AIDS-free generation. And part of the challenge is for us to think of how that road goes through our Latino communities. Let me give you some other numbers. So while Latinos are 16.4% of the overall U.S. population, they're 20% of new HIV infections. They're also the group that progresses to AIDS diagnosis within a year, the fastest group. That means, what does that mean? It means something that I think many of us here know, that Latinos are not accessing healthcare. They're not getting tested on time, and then they're not accessing healthcare. And part of that may be that Latino, and I just looked this up this morning, the poverty rate for Hispanics is now at 26.7%. And the unemployment rate is 10.3%. So healthcare becomes a major issue for Latinos going forward as we address the HIV/AIDS epidemic. A few other numbers to put out there. Hispanic males are 3 times as likely to have AIDS as compared to white males. Hispanic females are almost 5 times as likely to have AIDS as white females. Hispanic men are 2.3 times as likely as non-Hispanic white men to die of HIV/AIDS. So while we are making progress, we still have lots more to do. Today, we're commemorating the 10th year anniversary of NLAD, and we're very proud of having put the spotlight of in this nation on the needs of Latinos and Hispanics in the U.S. But I leave you with a few more numbers. By the end of 2008, an estimated 112,000 Latinos have died in the U.S. from HIV/AIDS. Again, we have much work to do. And HIV was the 4th leading cause of death amongst Latinos aged 35 to 44, and the 6th leading cause of death among Latinos aged 25 to 34. So while Latinos are the youngest population in the United States, HIV/AIDS is impacting this generation, and we need to make sure we address that. So again, this is exactly the time to renew our commitment to strengthening our communities. This is exactly the time when we must refocus and hone our efforts to have achievable goals. And this is exactly the time when we must re-engage our communities in dialogue centered around solutions and strategies that are action-oriented. May we leave here today feeling inspired to address this epidemic in our communities. Thank you very much.
Very inspiring and their words of commitment and encouragement. I'd also like to thank our speakers. Thank you for sharing your expertise with us. Thank you all for coming and joining us and listening to what we have to say today. And again, thanks for the staff, everyone that made this happen, especially John, who worked a whole lot to make this happen. So thank you. And thanks to all our partners that also made this possible. So I just want to let you know, ladies and gentlemen, this is an uphill battle. We are working hard to raise awareness, to get people tested, screened, vaccinated, look at treatment options, make sure that people are linked to care. Again, as some of our speakers mentioned, this is affecting the Latino community heavily. And as we know, Latinos are late testers, and we progress faster. Not only with HIV and AIDS, but also with hepatitis C. Latinos are the fastest progressing group that progress fastest to liver cancer, cirrhosis. So just one more thing, prevention is the key. It's cost effective. It's better for healthcare. We know that it's cheaper to get people to assess treatment options or get treated than to wait till they get to liver cancer and have need liver transplant that may cost around $500,000. So again, thank you, Guillermo. Thank you for the leadership with developing National Hispanic Hepatitis Awareness Day. This was the first year that we launched, and this is only a stepping stone. The campaign is a stepping stone for us. We are definitely committed and increasing our efforts to make this hepatitis, which is invisible in our communities, make it visible and be able to have healthier communities. So again, thank you everyone for joining us.
So even during the last 10 years since the commencement of NLAD in 2003, we have seen very dynamic changes in the HIV/AIDS field. And that was touched upon by many of our speakers today. During the International AIDS Conference that happened here just a couple months ago, we learned about medical advances like pre-exposure prophylaxis that greatly reduce the likelihood of transmission if taken by high-risk populations regularly. The key word here is regularly, right? How can we expect Hispanic Latino individuals to access care or adhere to treatment in areas where even getting to clinics due to lack of public transportation is an issue? Stigma is a barrier, where HIV is still considered only a gay disease, or where services cannot be provided in a culturally competent way due to a fast emerging population. We now begin to see that it's not just HIV or testing that needs to be addressed, but also the barriers that many of our community members face, which hinder them from not being disproportionately affected by this disease. Although National Latino AIDS Awareness Day only occurs one day a year, October 15th, the last day of Hispanic Heritage Month, it does not mean we should not strive to make our Latino Hispanic brothers and sisters aware of this epidemic during the other 364 days of the year. And that is a campaign that unifies our voices and makes it known that HIV/AIDS is so disproportionately affecting Latinos. It is one day when we provide aid and information to our Hispanic Latino community by hosting events throughout the United States and territories. It is a single day when community-based organizations, student groups, coalitions, churches, and many others declare their dedication to continue the journey for awareness and against HIV/AIDS stigma. And that is a day where we celebrate all the work we have done during those other 364 days of the year. I'd like to thank you all for being here today and striving to ensure, like our theme this year says, Hispanics United can end AIDS. Thank you.